Now, Emily Landon, an associate professor of medicine at the University of Chicago. Emily, thank you so much indeed. You've woken up early for us. Really appreciate it. How important is it? Yeah, how important is it to understand why some people are asymptomatic and others are not? Because we still don't really know that.
Yeah, this is how this virus really takes advantage of us. The fact that it can spread without anyone showing signs or symptoms of disease is absolutely a major issue. Usually we think of people as being contagious when they're sick, but if you can be contagious and feel completely fine, anyone could have coronavirus at any time. So more study is needed. That study out of South Korea is extremely important in helping everyone understand why it is so essential that we all wear masks and keep our distance.
Okay, you've mentioned masks, so let's go there. What about aerosol transmission? Over the past couple of months, I suppose, it's become more and more obvious. But what about the science that we understand again in this thing that we're still learning about aerosol transmission compared to us touching infected surfaces and then possibly touching our face?
It looks like there have been almost no cases associated with having touched something and then gotten it into your mouth or nose. You have to get a certain amount of virus in order to get sick, and that just doesn't seem to be an effective method. The aerosol or droplet spread, it's all in a continuum. Droplets are larger and can land directly in people's mucous membranes, like their mouth and their nose or their eyes. And aerosols float on the air a little longer and can also get into eyes, nose, or mouth. Now, when people wear a mask, it keeps those respiratory droplets, almost all of them, even a plain cotton mask that you can buy anywhere now, will keep almost all of those droplets inside the mask, which then protects everyone else. If you need to be around people who aren't wearing masks, such as in a healthcare setting or a place where masking is not required, or on public transportation or in a closed space indoors, it's important that you also protect your eyes. And eyeglasses like mine are not going to be enough because droplets can get in above and on the side. You really need a face shield and a good mask to protect you in that situation.
So people have to go to work, they might have to use a bus, they might have to get on a train. But what about social activities? Our reporter was just talking about what happens in, for example, a restaurant. Would you simply advise people do not engage in any social activities anywhere indoors because of the danger?
I think it's going to be impossible for people to not have any social activities, especially as the weather cools in the Northern Hemisphere. But we need to be really careful. You need to choose your group of close contacts. The people that you spend time with up close indoors, especially the people that you spend time with without a mask indoors, needs to be a very small group. If we keep all of our contacts like that to about 5 to 10 people maximum over the course of a week, then we're really going to be able to prevent a lot of spread. However, if we're seeing 10 different people on Monday morning and 10 different people on Monday afternoon, then you're going to have a lot of risk associated with any one person's infection. Now, workplaces where everybody's wearing masks and ventilation has been optimized are probably going to be okay, but it is important to remember that inside we need both masks and distance. You can't have one or the other because of the issue of recirculating air, especially as things get cooler and we close our doors and use our heating and cooling systems more.
Yeah, and of course, in a restaurant, that's particularly going to be a problem because obviously you can't wear the mask while you're eating. While we're talking about restaurants, do you mind if I ask you if you've seen any research about possibly picking up COVID-19 from an infected waiter or an infected chef? I've seen something that suggests that possibly because the virus is not spending as much time in the respiratory tract and the enzymes that we produce while eating, that might be able to keep us safe.
Yeah, actually, I think it's the heat and the temperature of the food that's really going to protect you the most. We know that coronavirus doesn't do super well in the heat, and that's why we haven't seen any foodborne illness of COVID at all. So I think that's not an issue. However, if your waiter or waitress is ill with COVID or contagious with COVID and not wearing a mask, they absolutely could spread it to you just like anyone else. But I don't think it's going to be on the surface of the food or you eating it. You know, we do have mucus in our nose, and our salivary enzymes are really good at helping protect us from all different kinds of pathogens. And that means that you need really an overwhelming or a larger dose of the virus than we initially thought. It just seems that through the air, that's pretty easy to get, but from surfaces and from food and things like that, it's pretty difficult.
Emily, I cannot thank you enough again, as I said, for waking up early to give us the benefit of your expertise. Thank you so much, Emily Landon.